afternoon, everyone who are here with us. Welcome. It's a pleasure to be here with so distinguished speakers and with all of us who have joined this forum to talk such an important topic, which is the environmental practice, something that really is going to ensure that we can keep on living in this planet. Will the planet die? Well, I guess we will die unless we do something. And we've been discussing this topic exactly in the week of COP26. I am Odete Freitas. I am a pediatrician by training. I am an older version. Myself and Álvaro, we are grandparents. And I worked at a mill, HMO, for many years, and my last challenge was to implement sustainability, known as ESG, in a huge healthcare company. And after this experience, and exactly what I'm going to try to share with you, I became the founding partner of a certifying company that wants to disrupt the certification of companies involving sustainability. I had a very interesting path in my career because health care companies usually don't think they have a huge environmental liability because we work with health, with life. But when we look closely to hospitals, for example, we are consumers of energy. We produce waste, contaminating waste, infectious waste. We have chemicals, we have radiochemicals, and it's much more than simply complying with the law. Of course, there are strict legislation in Brazil. We do have a lot of legislation, a lot of laws. Sometimes we don't have them properly enforced, but laws there are. And in addition to that, in hospitals, we are work intensive. So it means we can educate many families because we have a very broad reach. That's wonderful because then we have thousands of families that can be touched by our education. So families of our employees. So here we have DASA, we have Complexo, Pequeno, Príncipe, suppliers. We buy everything in hospitals. We buy sophisticated media. We buy everyday things. We buy screws for maintenance. So I think we can do a lot through our supply chain, through our procurement. And another thing that has really surprised me is the need to audit everything we do, especially our waste. Where do we dispose our waste? Because sometimes you hire a company, the company is fine, shows all documents, then you go there to audit the company, but unfortunately there are some gaps, some missing. So as purchasers of services, we have to make sure that whatever is promised is really delivered. In the area of hospitals, we have sharps and needles, a huge amount of products that may be disposed in what? Landfills, and families and children in low-income areas might go to these landfills to try to extract waste for to be sold for recycling purposes, and that's so risky. We have to bear in mind that the population has been increasing. We have all been seeing environmental disasters continuously. I was reading about that last year, so many fires, floods, and earthquakes and strong wind, drought in the area, floods in the other area, US, Europe, all over. And we still haven't realized that no matter how much money or influence we have, we cannot buy air, water, oxygen. We are always on the same boat. Once the boat sinks, we'll all drown. So I think, and a sentence that we have been emphasizing is there is no healthy people in a diseased country, planet. So we won't be able to survive unless we have a healthy planet. Once again, the pandemic has shown us that we are fully integrated, we are interconnected. It doesn't matter if we have more money to buy PPE or to buy vaccines, because ultimately we will just be doomed to fail if we don't do it all together. So as healthcare professionals, we really have to stop and think, what can we do to bring down waste, to really separate and recycle what can be used from our raw material. So reduce, reuse, recycle. A lot of organic waste that can go into composting and come back as food. So tons of materials that can be sent back to us as potential nutrients for plantation and growing. So it's wonderful to have 2,000 people who registered to this conference. So let's really think together. What can we do to have our home, the planet where we all live, prepared for all of us to live better, us and future generations? Because I guess we are on the limit. We have to do something. So I'm going to ask now David, who's going to be our first speaker, who has brought good news about technology, because I think that what can really brings us good news about the future is technology, something different, something that will really provide us better conditions for the future. So it's great to have you here, David. Thank you very much. I know that you have good news in terms of devices for hospitals to deal with this challenge of managing infectious waste. So welcome.
Thank
To
you.
you
Thank you
now,
for
10
having me.
minutes. Thank you. And tell
Thank
us
you for.
where you were speaking from, please.
So I'm speaking from Israel. So a short introduction. Hello, my name is David Segev, and I'm the CEO of Envomed. So Envomed is based in Israel, and we have developed an innovative, eco-friendly, on-site, sustainable medical waste treatment solution. And today I would like to talk about, in general, to talk about the challenges of medical waste treatment. So, as you probably know, most countries and most Western countries still treat their medical waste on offsite by actually using incinerators rather than treating the waste on site by the current heat treatment technologies available on the market. I mean, let's face it, it makes more sense to treat the waste immediately at the same place it was generated. So clearly, the use of incineration introduce high carbon footprint, extensive air pollution, and additional public safety risks. So, so why do countries overall and Western countries still use incinerations? So, being a highly regulated institute, hospitals must use a validated medical waste treatment procedures. And medical waste treatment is extremely challenging, and the validation process cannot be easily carried out, even for the current equipment, heat treatment technologies, which are the autoclave. Um, it's because medical waste includes both solids and liquids, and the mix and volume is keep changing from batch to batch, and therefore it is very difficult, or let's say impossible, to validate the process. And in order to understand the problem, I will explain shortly how autoclave works, and then you will be able to understand the challenge. So Autoclaves, they've been around for many, many years. They've been used heavily in the medical field, and are validated solid technologies, and they've been used for medical devices. So how does autoclave work? So the first stage is a vacuum stage, and then the second stage is a sterilization stage in which we introduce steam. So why do we need the first stage, which is a vacuum stage? Because we have to remove all the air from the chamber in order to make sure that when we introduce the steam in the second stage, the steam will penetrate and precipitate all the hollow places and get into good contacts with the solids. So basically, if you think, for example, if we have a pipe, right? So we need to remove the air in order to make sure that the steam will precipitate the capillary tube, the inside of the pipe, and get into good contacts with all the solids, and therefore we can make sure that all the surfaces are sterilized. But as I told you before, the medical waste carries both liquids and solids, right? And the steam cannot precipitate, it will not penetrate the liquids, right? So the steam will be used as a medium to heat up the liquids. And this is and there here is the thing. The liquids take much longer to heat up and takes much longer to cool down because liquid has high heat capacity. So if you look at the autoclaves, the user will have an indication only of what's going on in the vapor phase. So they will know what is the temperature, what is the pressure, but they have no idea of what's going on in the liquid phase. That's why it is very challenging for hospitals to use this technology because they have really no idea. So even if you use autoclaves, regulatory agents will tell you that you need to do two things. So the first thing that you need to do is to use very long duration. So when we're saying very long duration, it means that you have to use something like 1 hour to make sure, because you have no idea what's going on in the liquid phase, to make sure that the liquid phase got into the critical temperature of sterilization. And here is the thing: there is really no on-site equipment that can sustain this kind of temperature and pressure for such long duration, because normally autoclaves can sustain this kind of temperature and pressure for 20 minutes or 30 minutes. So this is the first challenge. And the second challenge that regulatory agents will tell you when you're using autoclaves is that you must perforate the bags. When I'm talking the bags, I'm talking about the biohazardous bags. You must perforate them in order to make sure that the steam will penetrate the bags and will get into good contacts with the solids and good contacts with the liquid. And this is something that really nobody wants to do and nobody is doing, because it makes really no sense to take infectious waste and have somebody perforate the bags before treatment. And so this is extremely, as I mentioned, extremely challenging. And this is why hospitals for many years couldn't cope with this and choose to treat the waste off-site, on remote location, in most cases incineration. So what we did in Envomed, we basically took the disadvantage and we made it as an advantage, because we are treating the waste under a liquid phase. So this is the first time we introduced a method in which we are treating the waste under a liquid phase. So when we are treating the waste under a liquid phase, we have no issues with the liquids because they will be totally dissolved into our sterilization agent and will get totally sterilized. And we have no issues with the solids because the solids will be shredded into a confetti-shaped small particles, and then they will be highly mixed and highly agitated inside the sterilization agent in which we are ensuring good contact of all those particles with the sterilization agent. So at the end of the process, what we're getting solids inside of a liquid phase, and the entire process is very fast, so it's under 20 minutes. And at the end of the process, the liquids, we have a solid to liquid separator, so the liquids will go directly to the sewage. And because at that stage they're totally neutralized, they're totally safe, the solids will go directly to the sewage, and the liquids will go directly to the sewage. and the solids will go through a conveyor, will get squeezed, and the outcome will be a municipal grade shredded waste. So on top of this, we are as well shredding the waste. So the volume reduction is averagely 80%. So even if after this process you are still using landfills, we have a huge volume reduction. So basically, the entire process is very fast. You don't need heat, you don't need vacuum, you don't need special infrastructure. You can accommodate the instrument in any room in a hospital, because the, in terms of infrastructure, we need just tap water, sewage, and that's it. And we are actually the only technology worldwide that has a complete and comprehensive efficacy report separately, both for solids and for liquids. So we show time after time that we are sterilizing up to stat level 4, which is 6-log reduction, which is the highest level, both for solids and liquid, using real waste under real matrix. So we have the same matrix of medical waste like blood. So we have blood substitutes. So we can demonstrate that we have organic material like hemoglobin, lipids, or whatever you have in typical infectious waste, and we can sterilize time after time. We can demonstrate this efficacy report, and in this efficacy report that we can demonstrate that we are actually sterilizing both the liquid phase and the solid phase. And this has been very successful for us. And now we want to take it one step above, and we have now project running in the Nordic countries, in Sweden and Finland, in which we are actually taking the municipal waste. If you remember, after the process, we're getting a shredded municipal waste, and getting this municipal waste, and instead of incinerating it, or instead of sending it to landfill, is actually trying to recycle it. Because as you know, if you're taking, for example, the sharp categories, okay, if you are not using a plastic rigid container, so most of it, let's say 50-60% of it, will be stainless steel. So it will be very easy to recycle it and to recover the metals out of it, because it makes really no sense to incinerate metals, right? Even if you're using this waste for RDF, it has really no energy value to incinerate metals. So this is a project we are working now, and obviously we have we have an installation in the Nordic countries, we have installation in Israel, we have installation in South Korea, and as well in Singapore. And obviously we will be happy to introduce this technology in South America overall, and in Brazil in particular.
Thank you. Thank you very much, David. It was wonderful to hear you. And well, it looks quite promising. I wish we can talk a little more during the questions, okay? So now let me now hand it over to José Álvaro. He comes from Paraná, an activist and a great manager, as he wants to be recognized. So, José Álvaro, I love to see the prince behind you. This picture was painted to a patient of ours. Let me introduce myself. I'm 72 years old. I've been working in the market, and I was a director of Grupo Ultra. And then I just moved into precision engineering. Now, for the NGOs, and I apologize, his connection is really terrible. He's breaking up. I have represented the NGOs of the South region in the National Council of the Environment. I have passion for this area of the third sector. I have been a board member of this complex, Pequeno, Príncipe, for many years. But I would like to tell you where we are. We are in Curitiba, state of Paraná, in the south of Brazil. And what is this complex? It's a very large pediatric hospital with more than 100 beds. We have ICU beds, and we are a reference center for many services, most of them highly complex. We are a national reference in bone marrow transplant, heart surgery, solid organ transplantation, rare diseases. And there is one specificity in our organization. We started our activities in 1919, so 102 years of existence. And another important thing is that we serve public health care patients. We work within the rules of philanthropy that states that nearly 70% of our services have to be directed to the universal health care system, the public system. We also have a School of Health Sciences, Medicine, Nursing, and others. We also have a research institute in partnership with Pele. We are the only NGO in the planet that can make use of Pele's name as a brand. And in all our initiatives and in our research institute, we also have graduate studies. And now I would like to speak a little bit about environmental issues. In Curitiba, the city where we are, up to 2004, we had an open air sewage, and waste was collected from the whole city and disposed there. So common waste as well as healthcare waste, including chemicals and infectious, all sent to one common open-air sewage. Then, as of 2004, all different hospitals became responsible for disposing their own waste. So they had to decide where to do it. And as of this year, most hospitals and ours in special started promoting appropriate waste management policies. We started to improve progressively the waste separation because we had to pay for it at first. And we know that we had to do something to manage appropriately and also to try to reduce costs. And for infectious waste, we hired a third party who disinfected the waste using high pressure and temperature. We have also been managing closely water and energy. Because of cost issues, we used to put into place some actions to try to bring costs down. But as of 2012, things got somewhat more serious because thanks to a friend who was a board member in the Council of the Environment where I had a seat, he asked me, do you still have this practice in the hospital? And I said, well, yeah. And so as of the end of 2012, I said we can no longer buy, for example, products with mercury. We still had products with mercury at that time. So as you can see, we were the first hospital in the state of Paraná that became mercury free. It was wonderful. It was a very good decision, quite easy to be taken, because we really wanted to make a difference in our initiatives. As of 2014, we also started diving into waste management, because we had joined the National Association of Hospitals here in Brazil, called ANAP. And one of the KPIs that we have to monitor is waste management. So that has led us to, thanks to benchmarking against our own peers, we've realized that we had to do more. And at that time, we hired a energy consulting company and started to work in projects that provided energy efficiency. We brought together the energy distributor and the national regulatory agency. We've created a energy uh, productivity or efficiency project. And since then, we've already done 5 different projects. And this whole process of benchmarking against our peers has helped us really evolve in the area of energy consumption and waste management. In 2016, which is a very important year for us, because there was a serious storm here downtown, a storm really like an ice rain. And we realized that day that we are all subject to climate changes, all subject to the global warming. Well, it was really a very serious storm, something I had never seen in my life. And then really, we've realized that we had to do more, because the environment was suffering. For example, right now, it's the second time in the history of our city that for 2 entire years, we have been rationing water, because there is a shortage of water in the city, a large metropolitan city. And this is why we should have appropriate healthcare management programs to manage all elements. We have gained a lot of advantage, because we had been trying, we had been running projects, and we carried out one first study of our environmental impact. Of course, whenever we assess uh, situations like that, we really come across a number of things to be done. And that has really shed light into an understanding of regular brown economy and green economy. So now we have really a completely new agenda involving a number of green objectives. Right now, we produce 1.86 kilos of waste per patient day, whereas the average in the association is higher than 3. So as you can see, we compare quite well. Likewise, when we bring together all different waste, so regular waste and infectious waste, it's 11.19 kilos per patient day, as opposed to 15.49 average of the association. So once again, we are outperforming our peers. We also manage infectious waste and also hazardous waste. and we comply with all the legislation in place in Brazil. And I think that we are really performing quite well, also because we have a number of projects that help us understand what we do, what we produce. We have agreements with different companies here in Paraná to help us detect the effectiveness of all the sewage treatment systems that we have and whether they are effective or not to get rid of contaminants. So now we have a pilot project to try to see how we can improve this situation.
And with a green agenda, for example, and I have some specific numbers, and in terms of everything that my hospital generates. So we have included those items for our improvement. We look after a forest with 8 hectares. We do composting, and we use the compost in our greenhouse, and a garden of herbs for teas. Mm, And then we bring those herbal teas to the hospital, and we serve those herbal teas to our patients and staff. And through this tea, we remind them of the concept of single health, that we need to be worried with environmental issues. Going beyond that, the fact that there was a major storm in 2016, that storm happened again on September 18th, 2019. Huge storm causing major problems. And this gave origin and caused a plan which led to a decision, and we have quantified the emissions in our complex in 2019 and in 2020, and we decided to compensate and mitigate too. And for the compensation, so with a major Atlantic forest reserve where we capture twice as much, twice higher than our emission. We are the second hospital in the country to do that. And we are very proud of our patients, employees, staff, everyone. They do not need to worry about that. In addition to mitigate, we are prolonging compensation. So my final message is, it's impossible to be very good in environmental area. And to the market, and well, thank you very much. I am sure that people will want to interact with you more and more, and that you're going to receive lots of comments, because we really need to copy best practices. Thank you very much. Now we are going to hear Lílian Mendes from DASA, talking about the challenges in such a big network that you have been dealing with. Thank you very much for accepting the invitation in the last minute. Well, first of all, I would like to thank you for the invitation, and also to hear other speakers who were very interesting, and I learned a lot from them. And I would like to start talking about DASA for us to understand a little bit how big it is. Today, our purpose is to be the health that people want and that the world needs. And we have a motto: healthy planet, healthy people. So we have always worried about environmental issues. DASA has always had a environmental department. Now, more recently, we have an ESG department. It's new, but it's also an opportunity, not just because of everything that we are going through, because of climate change, but we want to be leaders in health. So DASA wants to make a difference, both in environmental, social, and governance aspects. And this is related to a more strategic aspect. We always wanted to be compliant, strategically speaking, with environmental, but now it's much more strategic, more focused on us understanding how can we align the environmental, social, and governance pillars and how it can relate to the company's strategy. So we have conducted strategic planning in the company together with the area of strategy. This was very interesting and we learned a lot. And then we built our materiality matrix. And then we consulted many different stakeholders, opinion leaders, patients, doctors. And we learned a lot from listening to them and understand which would be the most important themes for DASA and the environmental pillar and received great emphasis. So we are going to place much more emphasis. Today we have 40,000 employees, about 19 hospitals all over Brazil, and more than 900 units. So it's really a big challenge for us to level in all levels of organization for them to have the same knowledge and culture. Although we have an environmental department, people have easy access to environmental themes. We provide yearly trainings for everyone to be up to date, to ask questions, and this is also part of our portfolio. And then talking a little bit about our latest updates, especially with regards to environmental issues. Now we have adhered or joined the Global Pact. So we take part on different levels and forums. So we have interaction with other companies and understand how this is working. We also had the first inventory of greenhouse effect gases. So we have identified all emissions in all operations, both in hospitals and diagnostic services. And then we understand how big it is. We're mapping it. So once we are able to quantify our emissions, so in the strategic planning, we wanted to define which are going to be the priorities for 2021. And this is the project that is leveraging the environmental actions of our group. In these years, we are building a renewable complex. So we are building 17 solar farms that will supply for 10 years 50% of our lab units, and about 610 units will be using solar power. So this project is our flagship environmental project, through which we are going to reduce emissions. So much so that in 2020, we failed in emitting, we didn't emit 2 tons of CO2. So this is something we want to highlight. In addition to our inventory of greenhouse effect gases, we had the environmental week for the entire company for all 40,000 employees. So we had Pedro and Dulce talking to our employees and the latest news. And this is all very important so that employees are engaged with this theme. We also have a recycling program and we are expanding it to our hospitals. Many hospitals have wonderful recycling programs, and we want to expand it to hospitals that still have to improve or can improve. We have donation of electronic devices, and we also have a strong campaign for the reduction of consumption of water, power, and disposable cups. And so this is in our tool in the workplace for our 40,000 employees. So we have lives and there are many programs. And the objective is to build awareness amongst the staff, not just for reduction, but also to understand a little bit more about the environmental. Also considering the imminent water crisis we are dealing with in Brazil, so that we can effectively strengthen our environmental pillar in a company. So that's all we have today at DASA, and we are very happy to have this new ESG department, which is a department that has come to enrich our actions, providing a more strategic approach. Thank you very much for your presentation. Now, to start, I would like to ask a question to each one of you while we wait for questions from the audience. David, I was very impressed with your equipment, and I was investigating everything in the world at the time. A mill has a large chain of hospitals, and we didn't see anything disruptive except for plasma technology, which impressed me a lot because you ended up producing power. But the supplier here in Brazil, who adapted to a lower cost, they're having lots of difficulties and didn't really thrive. And I was very impressed with your solution because it looks like to me, and I would like you to confirm it to me, is the ease to install it locally. Because whenever transportation is difficult, number one, and the other thing, it shreds materials. So we preserve the possibility of the danger in handling these materials. We know that we have a huge challenge, which is the discrepancy in the FX rate today to import any foreign equipment to Brazil, because now it's a big difficult, especially for smaller hospitals. But in terms of installation, it seems to me that it's very easy, very simple. So for each cycle, how much can it operate? Is it on 24 hours? How much footage does it take? Um, and in environmentally speaking, you said that it is very eco-friendly. What about the guarantee in terms of disposal of the liquid, and if anything is discharged into the atmosphere? Many hospitals would be interested in that and would be interested in learning about that type of equipment.
Right. So the instrument itself will treat 80 liters of waste per cycle. Each the instrument, as I told you before, the instrument does not need to have like a heating stage or a cooling stage, so we can go continuously. So we can do 3 cycles per hour. So we can do 240 liters per hour. So one instrument, if it is run one shift per day, let's say between 8 to 9 hours, can treat the waste being generated by a hospital of the size of 300 beds. And obviously, if it's a bigger hospital, we can accommodate additional machine because the footprint is very small. The entire machine is less than 3 meters long and less than 1 meter width. And as you mentioned, the infrastructure is very basic. In some cases as well, we can install the machine inside a department. Let's say, for example, you have a department in which you have highly infectious waste and you don't want to evacuate the waste outside of this department. So the footprint is so small and the infrastructure is so basic that you can actually install the machine inside the department and treat the waste inside the department. And in terms of sustainability, as I mentioned before, we have a sterilization agent which is under a liquid phase, our biocide. The commercial name is Biocetic. And it is a very powerful oxidizer because we need a very powerful oxidizer to sterilize both the liquids and the solids, especially the liquids under carrying heavily organic materials. And it is based on the synergistic effect of peracetic acid and nitrogen peroxide. So after the activation stage, which is only 12 minutes, as I mentioned before, the sterilization agent will be dissolved into water, oxygen, and acetic acid. obviously acetic acid is vinegar. So at the end of the process, we're getting water, oxygen, and acetic acid, and this process is totally safe. So at the end of the process, we can divert the liquid phase directly to the sewage. So this is why it is sustainable and eco-friendly.
Thank you very much. I'm sure all hospitals were very curious about it and will certainly get in touch with you. José, Álvaro, I would like you to tell me, we don't have much time, we don't have very long, but let's try and answer one question. Uh, the price to quantify and the price to compensate carbon. What can you tell me? Well, I can tell you that we issue, or the calculation for 2019 and 2020 was for the issuance in 2019. 822 tons of carbon, and remember, and in 2020, with lower movements associated to the pandemic, we had 802 tons of carbon, and we are promoting the compensation of that, capturing 1,529 tons of CO2 per year here on the coast of the state of Paraná, and by conservation of biodiversity and reforesting of native species on degraded areas in 10 hectares. And so we are paying 54,000 BRL per year, meaning, so for our organization, which is in terms of financial transactions, we had 320 million BRL per year. So promoting the compensation of issuance cost us 54,000 BRL. It's very, very little, insignificant. It's really worthwhile. And we chose this option because if you want to go there and see there, the practice, things in practice and the forest growing and everything. So that's why I said, yes, it is possible and it's not expensive. And there is space. Thank you very much. It's a very important example for everyone listening, because it's not just about reducing issues, but we also need to sequester whatever is up there. It's easy, it's not difficult, and it's cheap. So all we need is awareness and accountability of the major organizations hearing from us, labs and all imaging services, hospital chains, because this is nothing close to the hospital's budget, and it's assuring the health of people. And this is what we want to do in the health industry. We want to preserve health. This is necessary and urgent. It's a pressing need. I agree with you. Lílian, you represent so many units spread throughout Brazil, and because whenever we sit on a panel, but they say over there in England, in France, because in Brazil, which Brazil? Which Brazil are we talking about? There are many countries within Brazil. Southern Brazil, in the center, west, north, northeast. So the challenges for you to be able to adapt good practices to the different Brazils that we have. So one thing is to talk about São Paulo, another thing is to talk about forest or the center west. Yes, it is a big challenge. We have always had that challenge. And more recently, in terms of environment, we have identified the many different environmental aspects. So this was the first impact for us to understand what is the impact and how we're dealing with this in each region, and what are the opportunities to do something extra, a plus, in addition to what we are already doing, other than just legal compliance. Also in environment, there is an intern that is focusing on this project, studying each region in Brazil and the opportunities, because they are different. So, for example, there are many opportunities with cooperatives, but then there are many recyclables. They go to a local co-op, and we've been doing it for almost 10 years. So we really have had this opportunity there. But then there's compliance. We need to understand which is the most appropriate cooperative to conduct an audit in the cooperative. So I think it's really a big challenge, but we are thinking of different ways to deal with it. One important way is that we have ambassadors in each region, and this is what we are going to do. So let's say we have several volunteers today, and we want to have more actions, the social and other areas. So these ambassadors, they are going to launch local products in some regions, and will leverage some projects. So there are some more local projects and more corporate projects. And so they start corporate and they are spread throughout the country. And for the local one, there will be ambassadors or champions that are going to champion those projects with a more local action. We have 5 minutes, and if we are very brief, each one of you can ask a question to whomever you want. David, would you like to ask any questions to any of the fellow panelists? David, could you open your microphone, please? We can hear you.
Sorry. So I'm sorry about this. So actually, I was saying that we are just about to run a project in Panama. Hopefully, we'll be able to install the first units in Panama in the first quarter of next year. So I hope that we can cooperate as well on this.
Okay. José? José Álvaro, would you like to ask a question? Well, instead of asking a question, I would like to reaffirm that yes, it is possible. It is possible to do composting with organic waste. It's possible to have activities of producing your own tea and introduce the tea time in a hospital, and the tea time be used to talk about environmental issues for patients and families, uh, and also to talk about the importance of expanded single health for human health, for the atmosphere, for all the niches and wherever we interact. So we should remember that this is possible. So we need to have will, we need creativity, effort. It's a lot of work, but it's very nice to see that our employees, we are almost 4,000 people working here, 10 times less than DASA, but it's good to tell them that we are making an effort for each one of them, and yes, this is possible. As I said, it requires an effort, it requires some work, but it is possible. So here's an encouragement, and I am available for anyone who wants to talk to me for hints and our partners in the compensation, which is SVS, because yes, it is possible. Thank you very much. Lilian, you have 1 minute to say something to us so that we can wrap up. Well, I think that I am going to go along the lines of José Álvaro. We are here sharing learning experiences to talk a little bit about what each one of us does, and we saw what is possible and what we can do. So I would just like to reinforce the incentive. It doesn't matter how big the company is, if it's very big or small, there are many opportunities. This is possible. This can be done in many projects. I have also worked in smaller companies, and I had the experience of us being able to implement. There's a bigger challenge when the company is large, but it depends very much on willpower and on the culture that we want to implement in the company where we work. So I would just like to reinforce this kind of behavior and look and the importance of reinforcing the environmental pillar. I would like to thank you all very much for your generosity of sharing your experiences with us, and everyone who had the patience of listening to us. It's a message of hope. Because yes, it is possible, as José Álvaro said. I have 7 grandchildren, and I want them to have a life that is at least as good as ours. Uh, um, if it's not just for love for the whole world, it's just but because of a selfish look towards your children and grandchildren. But we have the duty of helping, and we have an abyss in terms of income in our country, and there are many different countries, so there is a lot to do. And I was really excited with what David presented to us, because we really need to treat infectious waste, because there are faraway places in our country where they still use landfills um, to dispose waste, infectious waste. So on behalf of José, I would like to thank everybody for the invitation. Thank you all very much. I hope that I was capable to be up to your knowledge. Thank you all very much. Huge pleasure
Thank
to be
you.
here interacting with you. My best regards, and I hope that very soon I will be able to hug you, and hope to see David in Brazil very soon in person. Thank you all very much.
Thank you.